Hello, and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on mesothelioma under the section of respiratory medicine. So what is mesothelioma? It results from inhalation of asbestos and approximately occur about 20 to 40 years after initial exposure. As far as signs and symptoms are concerned, it's really quite similar to lung cancer in that the most frequent symptoms that the patient may present with include shortness of breath, unintentional weight loss, and chest wall pain. As for its signs, you would be seeing pleural plaque thickening as well as pleural effusions with associated reduction in chest expansion and breath sounds. When you're suspecting someone with possible mesothelioma, it's really important that you take a detailed history, as many other scenarios that we have already been discussing. It's really crucial to pay particular attention to occupational history as well as smoking history, as there's a symbiotic relationship between smoking and asbestosis. Then after that, you would be moving in a systematic order. Say if this was your PACES station, you would want to do some blood tests on the patient to look for any evidence of anemia, of chronic disease, or raised inflammatory markers. Then you would move on to do some imaging in the form of an X-ray initially. However, if you're suspecting malignancy, carrying out a CT scan of the chest, plus minus abdominal and pelvis remains key. The gold standard of diagnosis for mesothelioma is biopsy and aspiration. The management of it is really surrounding a few things. First and foremost, you need to make sure that you advise the patient about smoking cessation, as well as legally you do need to tell the patient that they are able to be compensated by the government under the disability pension. And it's really important also for the context of PACES to also mention this. In terms of the rest of the management, broadly speaking, is divided into three categories. Medical management, which includes pleural aspiration for symptom relief, and pleurodesis, which must only happen once the tissue diagnosis is confirmed. In rare cases where there is only evidence of limited disease, you can consider referring the patient to rib and lung resection. And then, unfortunately, the reality of the case is that because of how aggressive this disease is, by the time it's diagnosed and picked up, really the hallmark of management will be surrounding palliation and pain control. It's really important that if this was a case of PACES, for instance, in your history station, you do need to make sure to comment on bringing and involving the appropriate members of the multidisciplinary team or the MDT, including the palliative care team, including nurses and consultants, as well as the Macmillan Cancer Support. As we have already discussed, unfortunately, the prognosis of this condition is exceptionally poor and the median survival is only about 1 year. Let's do some questions. Which of the following is incorrect? All patients with the diagnosis of mesothelioma are entitled to government compensatory schemes. B. Mesothelioma is particularly high risk for seeding, therefore drain sites should be irradiated. C. Median survival of someone with mesothelioma is 1 year. D. Pleurodesis can be done as soon as diagnosis is suspected. E. Recurrent pleural aspirations can be considered for symptomatic management of patients with mesothelioma. So if you recall from our discussions earlier, you will hopefully remember that options A and option C are correct,
You must inform all the patients with a confirmed diagnosis of mesothelioma that they would be entitled to government compensatory schemes. And unfortunately, the median survival is very poor, of about 1 year. Given the fact that this is a really dangerous disease, it's also really important to be thinking about management of patients when you're putting chest drains in them. And mesothelioma are particularly notorious for seeding. So if you decide to have a chest drain in a patient, it would be important to make sure that the drain site is irradiated to avoid the cells to seed. With regards to option E, it's also quite logical, not just in the context of mesothelioma, but any other condition such as lung cancer that leads to recurrent pleural effusion. It's not too uncommon to see patients coming to hospital or respiratory outpatient clinics to have their pleural effusion drained. So therefore, option D is the incorrect option, which if you remember, you will know that pleurodesis must only be done once the diagnosis is confirmed on tissue, and it should never be done on somebody who's just having a query of mesothelioma.
Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.